Hello everyone, my name is Pavitra Vyas from Department of Information Science and Engineering, Sri Venkateshwara College of Engineering. Today I am going to present my technical seminar on the topic Spatiotemporal Mammography based deep learning model for improved breast cancer risk prediction. Contents: Introduction, related background, working implementation, future enhancement, conclusion, and then the references. Moving on to the introduction, breast cancer is one of the most commonly occurring cancers among women. Some of the important factors which is the root cause for breast cancers are: first one is increasing in age, then comes the obesity, uh, consumption of alcohol, and then tobacco usage, post menopause. Early detection of personalized risk assessment can reduce the mortality rate and it will gradually improve the survival rate. Mammography is the standard screening tool in breast cancer early detection programs. It is hypothesized that exploiting the spatiotemporal analysis among different screening time points can improve the risk prediction outcomes. They have proposed using Siamese neural networks to incorporate spatial and temporal information into the risk model. Spatial is nothing but space and temporal meaning time. This aims to further improve the risk prediction models by exploiting the spatiotemporal information in multiple screening time points. Related background: spatiotemporal. Spatiotemporal is a data analysis which is a growing area of research with the development of powerful computing processors like graphic preprocessing units, which is used for big data analysis. Mammography. Mammography is a medical imaging technique that uses a low-dose X-ray systems to examine the breast. It's primarily used for early detection and diagnosis of breast diseases, especially breast cancer. Screening mammograms. A screening mammogram is an X-ray picture of the breast, which is used to check for the breast cancer in women who have no signs or symptoms of this disease. It usually involves 2 or more X-ray pictures or images of each breast. Value of interest lookup table. The modality LUT is used to transform the pixel values into the values of modality. The values of interest LUT is used to transform the modality into a visible range that enhances specific anatomical structures or pathological conditions. CNN model. The CNN model works by extracting the features from the mammogram images through various layers of convolution and pooling. Siamese model. In the context of spatiotemporal analysis, the Siamese model can be used for tasks such as object tracking, that is to identify and to follow objects as they move across the frames in the video. Attention mechanisms, focusing on specific regions of features within the data that are relevant for understanding the movement or changes over time. Here are few reference papers. First one is early detection of breast cancer using diffuse optical probe and ensemble learning method. Here they have used regression models which includes polynomial regression, support vector, k-nearest neighbors, decision tree, multilayer perceptron, random forest, XGBoost, CADBoost, extraterrestrial degraders, and many. Here they have achieved 100% of accuracy in classifying the optical properties. Breast cancer risk estimation using patient health information and tactile sensing systems. Here they have applied this to 7 cases and it has achieved 86% of accuracy in detecting malignant tumors. Next comes robust AI-enabled simulation of treatment paths with Markov decision trees for breast cancer patients. Here they have deployed AI/ML-based methodologies and they have studied the developing such an MTP leveraging domain knowledge which contributes to the importance of the treatment path simulation for breast cancer patients. Moving on to the implementation path. First one is data collection. Here they have collected 378 patients' mammogram images in the time interval from 2015 to 2019, and they have excluded some of the patients wherein they have diagnosed before, and totally they have got 191 patients samples. In that, 61 patients have been diagnosed with cancer and the remaining 130 patients have been safer from cancer. Here is a graph wherein the first graph indicates the age distribution, and the second graph is based on the screening time points difference, that is T2 to T1. It is the month difference. Next comes the data pre-processing. Firstly, they pre-process the data. It is done by applying value of interest lookup table. Secondly, they normalize the image by restricting the values between 0 to 1. Finally, the images were resized to 512 into 512 size. Third step is model development. They have developed CNN model and Siamese model for spatiotemporal analysis. CNN consists of four convolutional layers. The first one is ReLU activation function. Next comes 3 max pooling layer. Next, 2 fully connected layers, and the last one is a final prediction layer. Here, the first one is CNN architecture, which indicates all the 4 layers, and next comes the Siamese diagram, wherein there is an indication of the time points, that is the T1 and T2. Last is evaluation. The performance of proposed network was compared against the spatial only CNN via the AUC accuracy and F1 score. AUC meaning area under cover. Studied the performance of each model, that is CNN T1, CNN T2 and Siamese across the different breast categories and across different age groups. Lastly, they have studied the effect of time difference between 2 time points, that is T1 and T2. Future enhancement. First one is multitask learning. That is usually they only recognize what actually is the effect of breast cancer. Than identifying only the breast cancer, they can even identify tumors and many. Clinical interpretability. Interpreting the clinical aspects. Longitudinal analysis. Longitudinal analysis is performed to indicate or to recognize the breast cancer's risk predictions. And next is integrating with clinical workflow. Integrating the models with clinical workflow. Conclusion. A spatiotemporal deep learning model that leverages breast changes across screening time points, it improves breast cancer risk prediction. The improvement was shown across different metrics against 2 CNNs that use only spatial indicators at 2 different screening time points. In addition, when it comes to the medical aspects, there is a testing called plasmia testing and HPV virus testing, wherein this testing should be gone through 3 years once. After this testing, we get to know in prior, after 3 years, will we get cancer or not. And then comes HPV vaccine, wherein this vaccine should be given from the age group of 11 to 19. 1 dose vaccine should be given. After this vaccine is taken, there is 99% of assurity that the woman or the girl will not undergo any kind of survival cancer in the future. Here, these are few references papers which I have referred for the same topic. Here I complete with my topic. Thank you. Have a nice day.